Hello, Enid. I'm Derek Silas, the Director of Communications for the City of Enid, and I have with me
Diana Hernandez, Communication Assistant.
And today we're going to get a update with the Garfield County Health Department. Today we have Maggie Jackson, Director of Community Engagement and Planning, and we have Ray Johnson, Health Educator. Welcome, guys.
Welcome.
Thank you.
Right.
Thanks for having us.
Okay, appreciate it. First of all, we'll jump in right here. Can you give us an update of the drive-through testing held last Friday?
Sure. We're so thankful for the City of Enid and their partnership on our drive-through testing event. Last Friday, we tested 98 people. It's been in the news this week that 0 positive results came out of that event, but it was well worth the effort. We are so thankful for the Garfield County Sheriff, the Enid Police Department, and the Chisholm Trail Expo Center, also Garfield and Enid Emergency Management for supporting this effort. Our staff worked so hard getting it together at very, very short notice. We put on these drive-through tests across the state because supplies were so limited before. We were not able to test. And then it was pushed out that the OSU lab was able to support us with testing capacity. So we said we've got to move quickly and see what kind of positive cases were out there. So along with that, Governor Stitt loosened the criteria for screening because we wanted to find potential patients who might be asymptomatic or have mild cases. So with that, we were testing people who were maybe had symptoms of a cold or allergies. We were just asking cough or fever or shortness of breath. So we did see some sick people, but they were not the worst cases that could be from COVID-19. So there were, we were surprised by having zero positive tests out of that effort. But what it tells us is that, we think that we're doing the right thing by staying at home. We are keeping those cases we do know about contained and isolated, and we're helping them not spread throughout the community so quickly. We do expect that positive cases are going to continue. So the message from this testing event is not that we should open everything up and go about business as usual again. The message is that is working. It's helping us keep the cases low in Garfield County. We do know of some more potential positives that are going to come out this week. So please continue to do your best to keep your neighbors and friends and family safe. We've been doing these testing sites in other counties. We have a 8-county district with the health department. So today I'm on site at the Major County Health Department where we are testing people in Fairview. So if you know someone that lives in Major County or surrounding area, please send them. We'll be here till 12 o'clock today doing COVID-19 testing. They can call the Major County Health Department to get tested today.
Very good.
So yesterday we were in Logan County and Guthrie, and the day before in Kingfisher. So we're pushing out tests across our district.
Thank you. Now, will there be another drive-through testing site here in Garfield County?
Sure. So the initial push was because we had so much limitations on supply. So we did that push last week. Now testing is available ongoing. Most days as supplies are ready at the Garfield County Health Department. So we don't have plans right now to do another large-scale drive-through. People that come to the Garfield County Health Department, they still do a similar practice where they stay in their vehicle, they keep their windows rolled up, they don't come into the office, and our nurses come curbside and test them. So we're going to continue with that curbside testing by appointment as long as we have supplies and the need for testing.
Okay.
Now, is Garfield County Health Department testing at the Garfield County Health Department?
Yes. So we can, we're doing those ongoing tests. We've had supplies to trickle in. So now in our district, all county health departments are able to receive appointments for testing. Some of our smaller counties are not available every day, but we ask them to call and make an appointment. We can take appointments 2 different ways. If you have a physician that maybe they don't have a test available at their office, or they for some reason can't test at their office, they can make a referral to the Garfield County Health Department or through the state epidemiologist. They can refer a patient for testing at the health department. The other way is if you have fever, shortness of breath, cough, or you're a contact of a positive laboratory confirmed COVID-19 case, then you can call our office and we'll just ask you those same questions, and we can make an appointment with you that way. You can also know that we weren't testing people under 18. Governor Stitt has put out that we can test through our drive-thrus people who are over 16 years of age with parental consent. And now with a physician referral, we can test children over 12 months of age. So we're able to do that now. Yeah.
Very good. So what is the process? Do they just come in? I mean, well, I'll say the actual process when they get there and they're testing for COVID-19, do they stay in their car, curbside? How do you do that?
Yeah.
Exactly.
Yes. So we are still taking precautions, and most healthcare providers are, to keep the potential contact very, very limited. So we ask that anybody who comes to our office, if they have any symptoms, that they do not come in. We are asking people to come to call our phone number, 233-0650, and that's posted at our front door. There's some signs that give our phone number if you drive up, and they are able to wait in the parking lot. The nurse will instruct them where to wait, and then the nurse will come outside to their vehicle and do the swab just right there in the car, keeping everybody safe.
Okay, so what are the up-to-date numbers of positives and negatives, and do you have any statistics about recovered people?
Yes. I did just receive the acute disease report, right? So,
Okay.
I think it is started just now. I got an email pop up.
Okay.
Sorry, we're getting. Oh, yep,
Yeah.
I can see it. I can see it now. Do you want me to go ahead and share?
Go for it. I'm opening.
So for the state, we have 1,794 positive cases of COVID-19, and actually, I'll share my screen if people want to see. So I'm just on the Oklahoma State Department of Health website, and you can go here. This first page here will show our cases for the state, and let's see, total cases for Garfield, it says 5, and we do have 1 reported death now. Which is just too bad to hear. But so this is our state site, and for negatives, negative specimens, wow, that is a new number. We have 20,000 total cumulative, over 20,000 total cumulative negative specimens, and those are from, oh, okay. Sorry, this is all just changed today from when I was looking at it 15 minutes ago, so I'm a little thrown off. So this is all total laboratory information that's provided to OSDH, because testing is done, testing is done through the state lab, and then there are multiple private labs that do testing. So getting all that data together can sometimes be a challenge, and we don't always have all the information all at once. And that's why you hear a lot of different things, or we don't always have the exact number. But it looks like they've changed this now, and now we're over 20,000 negatives and that 1,794 positives.
Okay.
Now, do you have?
Go ahead.
Oh, no, I was going to say, if you have any statistics or any number on recovered individuals.
Yes.
Sure. So another, if I'm not sure if my screen is still showing or not, but I'll go over here to, this is our, every day on the Oklahoma State Department of Health website, they put an executive report, and it's a pretty lengthy document, but it's really informative. It shows our hospital capacity, which we can go over, but this is just a quick overview. You know, it shows how many ventilators we have available across the state, days of PPE, and then here we can go into cases. So newly reported cases are 160. Oh, see, this isn't, oh, this is from yesterday. So this doesn't include the 17, the extra cases. So from, I guess we'll say, so from Thursday to Friday, there were, or sorry, that would be Wednesday to Thursday, right? Sorry, guys. We have this we had 814 active cases, 80 total deaths, and 790 total recovered. And the recovery, it's not there's no cut and dry, okay, you are now recovered from COVID-19. So this 790 is just a rough number. It does not, it just is saying they're not currently hospitalized or deceased, and it's 14 days after the onset or the report. But Maggie and I were discussing this earlier, that it's a really hard to pinpoint a recovery, and Maggie can talk a little bit more about that for us.
At the county level, we don't report how many cases are recovered, because we know that people with mild symptoms might be getting better faster than the average, versus people who might be hospitalized might have to have support for more than 2 weeks, 2 or 3 weeks, and so those numbers aren't reported locally because we can't get into the details of each case and where they are. There's also we're not testing for a follow-up to see if they're testing negative. We don't have the supplies to be able to do that. So to actually have a laboratory confirmation isn't realistic at this point, and that might change.
I will add to that, if my screen is showing, the CDC, they say, if you can see this here, it says, for most people, symptoms last a few days and they get better after a week. And they give some guidance on when to end home isolation. If a person is able to have a test, which not to my knowledge are we able to do that here to confirm recovery, they would have to be tested and have 2 negatives in a row to be able to confirm as recovered. And if they will not have a test, it's no fever for at least 72 hours. Symptoms have improved, and it's been at least 7 days since the symptoms have passed. But again, this can all be found on the CDC website.
Okay. Very good. Now, many people have been complaining that the numbers usually listed in the media, well, I guess you just answered that about the recovery numbers. So my other question would be, go ahead.
Just concerns about some delays in the reported numbers. And it's just unfortunate that, for instance, if there's a death, there is, there has to be a medical examiner report, and the hospital has, most people they're showing have underlying conditions or different conditions that could have been a potential cause of death. So they weed through those other potential causes. And so for COVID-19 reported death, sometimes there can be a delay. And there's also some challenges with where the reporting goes to. And so I think those things have been worked out, but we do have a reported death now in Garfield County.
Okay. So the White House task force talked about a peak of coronavirus, and we're seeing that now, or are there mitigations to prevent the flow of it working?
I can go ahead and answer this one. Because we're in a rural community, we have not seen our peak yet. We are, the mitigation is in effect by us practicing social distancing, and we are really hoping that by seeing all these negative tests that it's working and we're doing what we're supposed to be doing. But Oklahoma we're still increasing cases every single day. Enid we have not reached our peak yet in the state or on the local level.
Okay.
So I would say we are behind the peak. We have not reached our peak yet. So that is potentially still coming. So we need to keep doing what we're doing and keep with the social distancing and all our preventative measures.
So what are key points that you can remind the Enid community?
Sure. So I wanted to go over just those warning signs, which I'll jump back. I'm not sure. I'll share my screen again and jump back over to the CDC website to talk about that. And these are just to when to seek medical attention, because most people 80% of people that have COVID-19 or have symptoms of COVID-19 will recover at home and have a mild illness, but it's still scary, and it's important to know when to seek medical attention. So that would just be if you were having trouble breathing, persistent pain or pressure in the chest, a new confusion or inability to arouse, and bluish lips or face, which would be a sign that you're not getting the amount of oxygen that you need to. So that's a key point. And it's important, even though most people will have a mild illness, to keep these preventative measures going so we cannot overwhelm our healthcare system, to protect those people that do have the comorbidities that put them at increased risk for severe illness, and to keep our hospital capacity from being overwhelmed. Because if we look at that executive report, we are in good shape right now, but if we were to have a great number of cases and people get severely ill, there's a potential for our healthcare system to be overwhelmed. And that kind of leads me to talking about the face mask, which is a new guidance that the CDC has put out. And I believe statewide, we're really trying to push the message of wearing a cloth face covering in public. And there's a lot of confusion on, you know, is it effective? Is it really doing anything? And wearing the cloth face covering, for one, it's a reminder not to touch your face. It's a reminder that it's out there, and to take those preventative measures of washing your hands and washing your hands after touching a dirty surface, not touching your face. And they also protect other people. So we're seeing a lot of studies now are coming out saying that there are a high number of asymptomatic people. So that means that you carry the virus, but you don't have any symptoms, but you have the potential to give the virus to other people. So by wearing that mask, you decrease the risk of shedding the virus to other people. So that's why that guidance came out, and it's important to wear those face masks to stop the spread in that way. And I think Maggie is going to talk a little bit about these serology tests that are coming out now. It's really exciting, and it's going to be a way to test to see if we have antibodies for the virus.
Wow.
Yeah, so at some point in the near future, we will be able to do a blood draw and test for the antibodies for COVID-19. So this will help us with better data on when the virus entered the country, and you know, how it is spread throughout our communities asymptomatically, and before we had the capacity to test for COVID-19 through a nasopharyngeal swab. So we're looking forward to being able to offer that at the County Health Department. We don't have a release date or protocol for our nursing staff yet, but we will let the media know and the City of Enid know when we're able to test for those antibodies. It will probably be a selected group with some screening criteria where they had potential travel or symptoms at an earlier point in time. And so we'll let everybody know what that criteria will be and when that testing will be available.
Well, Ray, how can individuals in the community stay updated with the Garfield County Health Department's updates and the state's updates? And then you mentioned the executive report. Could you give us that actual URL for that also?
Yes, let me share my screen again. So the easiest way to get to this executive report, I am sharing it on the Garfield County Health Department Facebook page about once or twice a week, and the Enid Garfield Emergency Management app and Facebook page. We're sharing it there as well. It is updated every day. So you would go to the Oklahoma State Department of Health website, and you click on the COVID-19 coronavirus tab. And then when you go over here to news, you click Executive Order Reports and scroll down here, and then it's daily. So you get a daily report, and it does change. It's also, they get their data from, so hospitals report their, for this portion, so for hospital capacity, hospitals report, and that number on the right there, the hospital reporting compliance changes. So I think that just is, you know, if the hospitals reported all their information that day. So these are not hard set numbers, but this gives you a good picture of how the state is looking. And Maggie mentioned something earlier that I wanted to discuss. We go down here. So this shows our hospitalizations ever. So we've had 415 COVID hospitalizations across the state. 186 are currently hospitalized, 122 in ICU.
Breaks it down.
And then it kind of shows the death. The average age of deceased is 73.1 years old. And 67.5% of the deceased had at least one of those comorbidities, which would be diabetes, heart disease, or circulatory disease, lung disease. So that just kind of gives you a better picture of who we're seeing the real severe illnesses in. And yeah, and it shows our testing availability. So yeah, this is a great report for anybody that really wants to get some everyday updates and, you know, some deeper information. But to follow daily updates for the county, you can follow the Garfield County Health Department Facebook page. We post daily updates, lots of tips and information on testing, and you guys can ask questions there, and we will do our best to get you factual answers from the source. So it's always important. And one thing we just wanted to add is, I know it's a big weekend for a lot of people, and it's spring, and we want to, you know, celebrate with our families, and it's just important to keep these numbers down, to keep doing what we're doing, and keep up that social distancing and not have gatherings over 10 people, to just keep, you know, Enid's and we're doing okay right now, and we really want to keep it that way. We're not out of the woods yet, but we need to keep up the practices.
Okay.
Yes.
Very good. Any more questions?
That was it. You touched on the Garfield County Health Department guidance that you released, so that's great. Now you released that to where could someone find that if they wanted to read that? For the spring holidays? Yes.
That will be on the Garfield County Health Department page. I'm not sure if I've shared it there yet. And we'll just be reaching out to, that'll be on the Enid Garfield Emergency Management page, but we're just going to be reaching out to as many media outlets here that we can to try and share that message with people, because we understand that it's hard. You know, I want to celebrate. It's my daughter's second birthday tomorrow, and we're just doing a family gathering because we need to, you know, stop the spread. So
Yes.
we'll be wearing our face masks and hanging out at home.
Well, we really appreciate all the information you provided us, especially the executive report that's really
Yes.
detailed and breaks down everything that most people would want to know about what's going on with COVID-19 in Oklahoma.
Yeah, it's a great tool.
Is there any other last-minute updates or what have you that you would like to share? We don't have any online questions, so
Okay.
any last words?
We're
or-
seeing lots of creative solutions. I know that some churches are doing drive-in,
Yes.
where you stay in your vehicle. Some are, you know, doing some curbside ideas. And lots of, we're really getting out there with our video capacity, calling people, celebrating in ways that we can still keep our most vulnerable safe. Get creative, everybody.
Okay. Any final last words for you?
No.
Okay.
Thank you.
Thank
Thank
you.
you, ladies.
Thank you so much for having us.
No problem.
Thanks.
See you next Friday.
See you next week.
Okay. And thank
Bye.
you, Enid, for joining us for this update. Join us again next week at 1:30 from Monday through Friday to get an update of what's going on in our community in regard to COVID-19. We appreciate everyone out there. Stay safe.
Yes.